Dr. Hellman. How are you?
I'm very well, thank you.
And I'm so glad that you gave us a tour of your facility. I love it. You have everything primo to help women in staying beautiful. But let's talk about your expertise. Tell me about what your patients are now looking for and why you have the equipment that you do now.
My patients are looking to look beautiful, hopefully without any kind of aggressive intervention involving any kind of scalpels, from as earlier as possible and to as old an age as possible. So therefore, what I specialize in is treatments that can give them these kinds of benefits using minimal, not very aggressive, but effective kind of modalities to make them last younger, longer.
Wonderful, wonderful. And I can see by the equipment that you have, there's been a huge investment in this technology. Do you think most dermatologists spend that kind of time, money, and research in their practices?
I don't think most dermatologists would go as heavily into lasers because the laser equipment is very expensive and it has to be constantly updated. It has to be very leading
The technology is
technology,
important.
yes.
Right, right.
And therefore, it's a very heavy commitment, and I have made it early on in my career because I was fortunate to have a lot of training. And so I think most dermatologists, like to do some cosmetic treatments like injectables, Botox, Restylane, which is relatively easy to learn. They do it well, they do it less well, but it's
Right.
not, something where you can really go too wrong. But with lasers, it's a whole different subspecialty, and it's a whole different area.
I'm very impressed. I mean, this is the
Thank you.
first time I had a chance to visit your facility. Talk to me about the injectables a little bit. Why, I can see that you're more about the serious treatments as opposed to just the injectables.
Well, I think injectables are a wonderful way to make a big impact with a small treatment.
Okay.
And sometimes it's a subtle difference. For example, when you treat somebody's lines on the forehead,
Right.
even though they may not look like very disturbing when they are there,
Mm-hmm.
when they are gone, all of a sudden the whole face lights up. Because people normally have a very nice lower face, and the upper face goes much faster. And so, I think Botox and Dysport, which is the new form, are very easygoing, very well tolerated. People used to call it the aspirin of the 2000s. Now we are,
We're
talking
past
about,
all.
yes, kind of past. And I also think Restylane and Perlane and Radius, which are fillers, they're a very subtle way to lift and reshape the face and restore, for example, these lines
Right.
or this fat migrating south.
Right.
Okay, so when you put a little bit of extra padding under
Right.
the skin
Right.
with a little bit of an injectable, which
Right.
is no big deal, all of a sudden you get somebody who looks a lot more uh, youthful and fresh, and you restore the normal shape of the young face.
What is the average age of the women that come to you, and men, I'm sure?
I have people, for beauty related treatments, starting with acne really, from their early teenage years.
Okay.
And I have women doing it into their 70s. There's really no age limitation of wanting to look good.
What are the most concerning questions that patients ask you? What is their biggest one or two questions that they ask you?
Is it going to hurt, doctor?
Okay.
That's number one.
Okay.
And number two is usually, is there anything that can go wrong?
Okay. And obviously you have a lot of experience, you've been doing this a long time, and this is a very safe place for someone to have work done.
Yes, I always tell them that it's not going to hurt me at all. And in terms of risks, there's no risk.
Why did you pick dermatology as the profession of choice?
Well, first of all, my father was a dermatologist,
Okay.
so that was probably part of the reason. And then I realized, how gratifying it is to be in an area of medicine where you can actually do something and see the actual outcome and improvement, as opposed to the frustration of declining health and heart problems, kidney problems, internal medicine. It's beautiful, it's a beautiful specialty, but it's very saddening. So I kind of like the fact that my patients can walk out of here feeling really good about
Wonderful.
how they look. and that it affects their lives
It does.
in terms of their, self-confidence and their success.
Well, ladies, I'm so thankful that you tuned in. Watch Judith, Hellman, and myself. We're going to be doing more health, hair, and beauty events. We have all sorts of surprises for the fall. Tune in, and we will keep you posted. You're the best.
Thank you so much.
Thank you. Thank you.